Tonight, we bring you a deeply personal and transformative story. One that goes far beyond reality television fame. A story about resilience, accountability, medical risk, and the long road to reclaiming a life once overshadowed by extreme health challenges. A star from the hit reality series 1,000 Pound Sisters is making headlines once again. But this time, not for controversy or setbacks. Instead, for a stunning physical transformation following skin removal surgery after dramatic weight loss. This is not just a cosmetic update, it is the next chapter in a journey that has unfolded publicly for years. Tonight, we take a closer look. Segment 1. A journey that captivated millions. When 1,000 Pound Sisters first premiered on TLC, viewers were introduced to sisters battling severe obesity, addiction to food, and life-threatening health complications. Among them, Tammy Slaton became one of the most talked-about figures on the show. Her health struggles were not minor. They were critical. At one point, her weight placed her at immediate risk for organ failure, respiratory collapse, and cardiac arrest. There were moments when survival itself was uncertain. Multiple hospitalizations, oxygen dependency, rehabilitation facilities, emotional breakdowns. For years, critics doubted she would make it. Segment 2. The turning point. The transformation did not happen overnight. Following intensive medical supervision and a structured weight loss program, Tammy qualified for bariatric surgery, a procedure often considered a last resort for individuals with severe obesity. The surgery itself was only the beginning. Recovery required strict dietary control, therapy, accountability, and a level of discipline viewers had rarely seen from her before. Slowly, the numbers began to drop. Hundreds of pounds. But dramatic weight loss at that scale comes with consequences few people understand. Segment 3. The hidden struggle. Excess skin. When a person loses extreme amounts of weight, the skin, stretched for years, often cannot retract. This results in large folds of excess skin that can cause chronic infections, mobility limitations, hygiene complications, severe discomfort, emotional distress. For many, skin removal surgery is not cosmetic. It is medically necessary. Sources close to production confirm that after maintaining significant weight loss, Tammy was finally approved for skin removal surgery, a milestone that required medical clearance and proof of long-term stability. It was a high-risk operation. Hours in the operating room, intensive monitoring, significant pain. But it marked a symbolic rebirth. Segment 4. The reveal. When the star revealed her post-surgery appearance, reactions flooded social media. The difference was undeniable. A slimmer facial structure, defined body contours, improved posture, and perhaps most striking, visible confidence. For longtime viewers, the transformation felt almost surreal. Many remember the early seasons, the hospital scares, the defiance, the emotional volatility. Now, they are witnessing what appears to be a woman reclaiming control. Segment 5. Public reaction. Praise and skepticism. Supporters praised her determination. They called her transformation inspirational, unbelievable, a second chance at life. But not everyone was convinced. Some critics questioned whether the change would be sustainable. Others pointed to the history of setbacks shown on the series. Yet medical experts remind us, long-term weight management after bariatric surgery is possible, but it requires permanent lifestyle change. The surgery is a tool, not a cure. Segment 6. The psychological battle. Weight loss journeys of this magnitude are never purely physical. They involve food addiction recovery, trauma processing, identity shifts, public scrutiny, online bullying. For reality television figures, the psychological pressure is amplified. Every relapse becomes a headline. Every success becomes content. The question now is whether this transformation marks a permanent turning point, or simply another phase in a complicated public life. Segment 7. A family dynamic under the spotlight. Throughout the series, the relationship between the sisters has been both supportive and volatile. Viewers have watched arguments, reconciliations, and emotional confrontations unfold on camera. This latest milestone could shift family dynamics once again. Success can be just as disruptive as struggle. And when change happens publicly, relationships must adapt in real time. Segment 8. Medical perspective. Doctors say patients who undergo massive weight loss and subsequent skin removal often report improved mobility, reduced infections, better hygiene, increased self-esteem, greater willingness to engage socially. But the procedures are not minor. Complications can include blood clots, infection, fluid buildup, extended recovery time. The decision is never taken lightly. Segment 9. What comes next? Will this transformation alter the direction of 1,000-pound sisters? Producers have not confirmed future storylines. But if history is any indicator, the show has always centered around accountability, setbacks, and growth. This could be its most dramatic evolution yet. Segment 10. The bigger picture. Beyond entertainment, this story highlights a national health issue. Severe obesity affects millions. Access to medical care, psychological support, and long-term treatment remains uneven. For some, this transformation is hope. For others, it's a reminder of how complex obesity truly is. There is no quick fix, no overnight miracle, only difficult choices, sustained effort, and medical intervention. Closing thoughts. From oxygen tubes to operating rooms, from public doubt to public applause. This chapter represents more than a physical change. It represents survival. Whether this transformation endures will depend on choices made away from the cameras. But tonight, one fact is undeniable. A woman once written off by many has defied expectations. Tonight, we take a deeper look at a transformation that has sparked conversation across television audiences and medical communities alike. A star from 1,000-pound sisters has revealed the results of skin removal surgery following massive weight loss. A moment that represents not just a physical change, but a complex medical and emotional turning point. This is not a story about glamour. It is a story about risk, discipline, and the long-term consequences of extreme obesity. Played out in front of millions. Segment 1. A public struggle years in the making. When Tammy Slaton first appeared on TLC, viewers saw a woman facing life-threatening health conditions. Her weight once exceeded levels that doctors classified as critical. Daily tasks were exhausting. Breathing required assistance. Medical emergencies became routine. The cameras captured hospital visits, rehabilitation programs, and moments where survival itself seemed uncertain. But behind the scenes, physicians warned that without radical change, the outcome could be fatal. Segment 2. The discipline behind the headlines. Weight loss at this scale is not accidental. After qualifying for bariatric surgery under strict medical supervision, Tammy entered a structured program requiring controlled nutrition, psychological counseling, physical rehabilitation, ongoing medical monitoring. Experts say that fewer than half of patients maintain long-term compliance after bariatric procedures. Success demands a permanent shift in lifestyle, not temporary motivation. For months, progress remained steady. The scale continued to drop. But a new challenge emerged. Segment 3. When weight loss creates a new obstacle. Massive weight reduction often leaves behind significant excess skin, particularly after years of stretching. Medical professionals explain that skin elasticity decreases with age and prolonged strain. In extreme cases, the remaining skin can weigh dozens of pounds. The complications are not cosmetic. Chronic rashes, skin infections, limited mobility, lower back strain, emotional distress. Doctors determined that surgical removal was medically appropriate, but high risk. Segment 4. Inside the operating room. Skin removal surgery following extreme weight loss can last several hours. Procedures may involve abdominal panniculectomy, arm lifts, thigh lifts, chest contouring. These operations require careful fluid management and carry risks of blood loss and infection.